I believe what makes the Intermountain Vein Center unique is the combination of excellent staff and a great group of physicians. I'm very happy with the group of physicians that I have the privilege to work with every day, and also our staff. We really try to take care of each patient and make sure that they feel like they have had the best care possible. We do everything we can to diagnose their problem accurately with state-of-the-art ultrasound and other technology, and to make sure we understand their medical history and particular circumstances precisely so that we can prescribe exactly what they need. Every patient who comes through is a little bit different than the other, and we make sure that we address their specific problem.
Before I came to the Vein Center and had my treatments done, I was having very painful periods, and when I'd ovulate, I was in a lot of pain also. My pregnancies were really hard, but I thought that after my pregnancies maybe that pain would go away, but it didn't. And so after I came in and had my procedures done, with each procedure I noticed the pain lessen dramatically, where I was able to be more active and take care of my kids more and be on my feet more, which was the biggest concern because I wasn't able to stand for long periods of time. And having 4 small kids, it really wasn't an option to not be able to stand for a long time.
At the Intermountain Vein Center, we've had the opportunity to train physicians from around the country in multiple specialties, and this has been a great opportunity for us to not only train them, but to also hear and understand what they're doing in their practices to help us improve our service here. We have also had the opportunity to participate in many clinical research projects and have presented our data in national meetings. We pride ourselves in making sure that we're always practicing cutting-edge science and providing our patients the best care possible, and our participation in training programs as well as ongoing basic clinical research has allowed us to do this.
How does a patient know he or she has varicose veins? There are obvious signs which include bulging varicose veins, discoloration of the skin, swelling, or later on in the process, ulceration of the skin. There are also less visible symptoms that are more common that include leg aching, heaviness, swelling, or even pain. And recent studies have suggested that restless leg syndrome can also be associated with venous insufficiency. When a patient comes to Intermountain Vein Center, we do a comprehensive history and physical exam, and then they undergo a thorough ultrasound of the superficial and deep veins of the legs to evaluate each vein for venous insufficiency.
I had a very good experience at the Vein Center. I've been in and out for a couple of years, and I kept coming back because of the friendly staff and the doctors. I was always treated very kind, and they were very helpful in trying to lay out my treatment plan for me with all the various treatments that I had to have done. They were always helpful in making sure that my insurance was going to pay what they needed to pay, and always making sure that everything went smooth.
Varicose veins are an interesting problem, both medically and from a perception in the public. And I worry that the whole concept of varicose veins gets misconstrued by the public as being something cosmetic. Somebody sees an ugly bulge on their leg or discoloration, and they are almost embarrassed to talk about it with their physician because they may think that, well, I'm just being vain, or this is about how my leg looks. It goes way beyond that. Those problems, those types of problems, reflect an underlying very serious medical disorder. Your veins are responsible for taking blood from your leg up to your heart. And each of your veins have valves in them that act as a check to keep blood from flowing backward. If those are faulty or defective in any way, blood can pool in your extremities and it diminishes your circulatory health. Long term, that leads to problems such as tissue breakdown, discoloration. Some patients don't see us till they have active ulcerations in their legs, and it's very sad because had we seen those patients perhaps 5-10 years earlier, we could have provided them essentially a cure or a way to prevent that from ever progressing to that point.
The most common procedure we perform at Intermountain Vein Center is endothermal venous ablation, which can be performed with laser fiber or with a radio frequency antenna. The second most common procedure is sclerotherapy. This procedure involves injecting a chemical into veins to close the deeper, more tortuous veins. The third most common procedure we perform at Intermountain Vein Center is ambulatory phlebectomy, which involves a tiny incision followed by removal of superficial varicose veins. Part of the practice at Intermountain Vein Center is hospital-based. In the hospital, we treat deep venous thrombosis. Additional procedures we perform in the hospital include embolization for pelvic congestion syndrome in the female and varicoceles in the male. So most of the people presenting to Intermountain Vein Center come with varicose veins that are visible, that prevent them from wearing shorts and enjoying summer activities. Most of these people have pain. Untreated varicose veins can continue to cause ulcers and changes in coloration of the leg and feet. Through treatment, we can help people overcome the pain, help these ulcers to heal, and return them to a more normal life.
Blood clots that occur in the legs pose significant risk to a patient. Sometimes these blood clots can break off and travel to the lungs and compromise breathing and circulation. The clot that remains in the vein in the leg can actually result in scarring that compromises the outflow of the blood from the leg to the heart. When this happens, patients will complain of swelling, of pain, and even sometimes discoloration of their skin. Fortunately, we have the ability to treat these clots during a short period of time of about 2 weeks. We can actually insert an instrument into the clot that combines mechanical energy along with a medication that dissolves the clot. By clearing the blood clot from the leg, we can preserve the health of the valve and the circulation in the vein, and that prevents the complications such as swelling and pain.
I've been doing hair for 14 years, so I've been standing on my feet, and I've had 5 children. So I was experiencing some of the achy and just heaviness in my leg. Not only that, but also cosmetic. I just did not love the way this certain vein was looking. And I'm 33 years old, and I don't feel like I need to live with that. And so as soon as I had my last baby in January, I knew where the office was, and I came in and made an appointment. As far as my symptoms have gone, I work long hours on my feet, and I haven't had the achiness and tiredness that I was experiencing before. And I'm back exercising and running, and I feel great.
I would recommend others to the Vein Center, especially when I come across people that have had the vein problems like I've had, especially after having children, where you are still very uncomfortable and you cannot resume your regular activities. I have referred several of my friends to the Vein Center to come get treatments because I don't think everyone realizes that they can fix those problems that they're having, and there are treatments available to them.